Hey everyone, welcome back to the channel. I'm Dr. Natalie Brooks, and before we dive in today, I want you to hear something that might surprise you. I had a patient, 72 years old, come into my clinic last month absolutely convinced he was damaging his health. He was embarrassed, worried, and honestly, he'd been losing sleep over something completely natural. By the end of our conversation, he walked out of my office with a completely different perspective. And today, I'm going to share that same information with you. If you're a man over 50, 60, or even older, and you've ever wondered whether your personal intimate habits are actually good for you, or if you've laid awake at night worrying that you might be doing yourself harm without realizing it, then you need to hear this. This topic has been buried under decades of shame, outdated advice from our grandparents' generation, and frankly, a massive lack of clear, honest medical information. So today we're going to change that. I'm Dr. Natalie Brooks, and I've been practicing medicine for over 20 years here in Canada. I've worked with thousands of men just like you, and I've heard every concern, every worry, and every question you might have about this topic. And let me tell you something right off the bat. What I'm about to share with you is backed by science, supported by major research institutions, including Harvard University, and it's information that every man deserves to know. Now, I know this isn't the kind of thing you chat about with your buddies over a Tim Hortons coffee or at the hockey game, right? But that silence, that stigma, that's exactly what keeps men in the dark about their own health. And that ends today. We're going to talk about 7 scientifically proven benefits of self-pleasure as you age, and then just as importantly, we're going to discuss the potential risks you need to know about to make sure what you're doing is actually healthy for you. So if you're ready to finally get some straight answers, no judgment, no outdated myths, just honest medical facts, then stay with me. And hey, if this video helps you, do me a favor and hit that like button so more men can find this information. All right, let's dive in. Let's start with the good news, shall we? Because there's actually a lot of it. First up, and this is something that surprises a lot of my patients, maintaining erectile function and blood flow. You see, when you have an erection, it's like a natural workout for your reproductive system. Blood rushes into the tissues, fills them up, keeps them elastic and healthy. It's honestly similar to how you need to exercise your heart to keep it strong. If you don't use those tissues regularly, they can actually lose elasticity over time. It's the classic use it or lose it principle that applies to so many parts of our body. Think of it this way. You wouldn't stop walking just because you're getting older, right? Because you know your legs need that movement to stay strong. Well, the same logic applies here. Regular erections help maintain the health of the blood vessels and erectile tissue. It's a simple, natural way to take care of a vital part of your body. And I've seen this firsthand in my practice. Men who maintain regular, intimate activity, whether with a partner or solo, tend to have better erectile function as they age. That's not just my observation, that's backed up by research. Now let's talk about something that really matters to a lot of you, prostate health. This is huge, and it's one of the most well-researched benefits out there. Several major studies, including a really significant one from Harvard University, have found that more frequent ejaculation is associated with a notably lower risk of developing prostate cancer. We're talking about a real measurable protective effect here. The theory behind this is pretty straightforward. When you ejaculate, you're essentially flushing out your prostate gland. Think of it like cleaning out a system, removing old fluids, toxins, anything that might have built up in there. By doing this regularly, you're potentially reducing the accumulation of substances that could contribute to cellular changes and cancer development. Now, I want to be clear. This isn't a guarantee. Nothing in medicine ever is. But it's a surprisingly simple and natural way to potentially protect yourself. And honestly, when I explain this to my patients, a lot of them wish they'd known about it sooner. All right, next benefit, stress relief and better sleep. Have you ever noticed that deep sense of calm and well-being after release? There's real science behind that feeling. During orgasm, your brain releases a cocktail of feel-good chemicals. Dopamine, which boosts motivation and pleasure. Oxytocin, which is known as the bonding or cuddle hormone. And endorphins, your body's natural pain relievers. These aren't just floating around randomly, they're doing important work. These chemicals help reduce your stress hormone levels, particularly cortisol. And in today's world, especially as we age and deal with various life stresses, managing cortisol is crucial for your overall health. High cortisol levels are linked to all sorts of problems: high blood pressure, weight gain, sleep issues, you name it. So by engaging in this natural stress relief, you're actually doing your body a real favor. Plus, that combination of physical relaxation and chemical release often leads to better sleep. And we all know how important good sleep is as we get older, eh? Here's something you might not have thought about: pelvic floor muscle strength. Yeah, I know, not the most exciting topic, but stick with me because this matters more than you think. During the physical contractions that happen during orgasm, you're actually exercising some really important muscles in your pelvic floor. These are the muscles that support your bladder and bowel control. As men age, weakness in these muscles can lead to urinary incontinence, which I know is something a lot of guys worry about but don't want to talk about. By keeping these muscles active and toned through regular intimate activity, you're helping to prevent or reduce these problems. It's like doing Kegels without even thinking about it. And trust me, maintaining control over these functions is a huge quality of life issue as you get older. I've had patients tell me that this alone has made a significant difference in their daily confidence. Let's talk about mood and mental health for a minute. Depression and anxiety become more common as we age, for all sorts of reasons: health concerns, retirement changes, loss of loved ones, you name it. But here's the thing: that release of dopamine and endorphins we talked about earlier, it doesn't just feel good in the moment. It can actually help boost your overall mood and mental well-being over time. I've had patients in their 60s and 70s tell me that maintaining this aspect of their lives helps them feel more positive, more energized, more like themselves. And there's research supporting this connection between sexual health and mental health. It's not a cure for depression or anxiety, obviously, but it can be one tool in your overall well-being toolkit. And honestly, anything that helps you feel better mentally is worth paying attention to. Here's another benefit that might surprise you: immune system support. Studies have shown that sexual activity, including masturbation, can actually boost your immune function. How? Well, the physical and chemical changes that happen during sexual arousal and orgasm can increase the production of certain antibodies and immune cells. Your body gets a little boost to its defense system. Now, this doesn't mean you won't get sick, of course, but in the bigger picture of maintaining your health as you age, every little bit helps, right? Especially during cold and flu season here in Canada, when it feels like everyone's catching something. Supporting your immune system naturally is always a good thing. And finally, let's talk about something that's often overlooked: cognitive function and brain health. There's emerging research suggesting that sexual activity, including masturbation, may have benefits for your brain. The increased blood flow during arousal doesn't just go to the obvious places, it goes to your brain too. Plus, the release of all those neurochemicals we've been talking about helps create new neural pathways and may even support memory function. Some studies have even suggested a link between regular sexual activity and lower risk of cognitive decline as we age. Now, the research here is still developing, but it's pretty fascinating stuff. And anecdotally, I can tell you that patients who maintain active, intimate lives, whether with partners or solo, often seem sharper and more engaged with life. Now, I had a patient, let's call him Robert. He's 68, came to see me about 2 years ago. He was dealing with high stress, wasn't sleeping well, and was worried about his prostate health because his brother had been diagnosed with prostate cancer. During our conversation, I explained many of these benefits we've just discussed. He was skeptical at first, honestly, but he decided to be more intentional about his self-care in this area. 6 months later, he came back for follow-up, and he told me he was sleeping better, feeling less anxious, and just generally felt more like himself again. Was it just the self-pleasure? No, we'd made other lifestyle changes too, but it was part of his overall wellness routine, and it made a difference. Now, before you think this is all sunshine and rainbows, I need to talk to you about the other side of the coin. Because like anything in health and wellness, there can be too much of a good thing, and there are some potential risks you need to be aware of. First and foremost, physical irritation or injury. If you're doing this too frequently or too vigorously, you can cause skin irritation, chafing, or even small tears in the sensitive tissue. This might seem obvious, but you'd be surprised how many guys don't think about this until it becomes a problem. The solution is simple. Use lubrication, be gentle with yourself, and give your body time to rest between sessions. If you notice any pain, soreness, or unusual symptoms, take a break and talk to your doctor if it doesn't improve. Here's a big one that I see more often than you might think: excessive masturbation interfering with daily life. Now, what do I mean by excessive? If you find yourself prioritizing this activity over your responsibilities, relationships, work, or other important parts of your life, that's a problem. If you're canceling plans, avoiding social situations, or neglecting your partner because of this habit, that's when it crosses from healthy self-care into something potentially harmful. There's also something called death grip syndrome that some men experience. This is when you get used to very specific, very firm grip during masturbation, and then find that normal sexual activity with a partner doesn't provide enough stimulation anymore. This can lead to difficulty achieving orgasm during partnered sex, which can obviously strain relationships and cause emotional stress. Another concern is the role of pornography. Now, I'm not here to preach about morality, that's not my job. But from a medical standpoint, excessive pornography use can sometimes lead to unrealistic expectations, difficulty becoming aroused without it, or even erectile dysfunction. Some men find that they can only achieve erection or orgasm while watching increasingly extreme content, which can be a sign of developing a dependency. If that sounds like you, it might be worth talking to a healthcare provider or therapist about it. I also want to address something that some of you might have strong feelings about: different perspectives on this topic. I understand that some of you have spiritual or religious beliefs about sexual energy, and I respect that completely. What I've shared today is the medical and scientific perspective based on current research. But I absolutely acknowledge that you may have personal, cultural, or spiritual views that are different, and that's okay. You need to make decisions that align with your own values and beliefs. This information is here to help you make informed choices, not to tell you what you must do. There's also the psychological aspect to consider. For some men, excessive masturbation can be linked to underlying anxiety, depression, or other mental health issues. If you're using this as a way to escape from problems in your life rather than addressing them, that's something worth examining. It's similar to any coping mechanism. It can be healthy in moderation, but if it becomes your primary way of dealing with stress or negative emotions, you might want to talk to a mental health professional. And let's be honest about relationships for a moment. If you're in a partnership and your solo activities are causing tension that needs to be addressed, open, honest communication with your partner is crucial. Some couples are completely fine with masturbation being part of each person's individual self-care. Others prefer to focus exclusively on partnered intimacy. There's no one right answer, but there does need to be mutual understanding and respect. Here's the bottom line, and this is what I tell every one of my patients. A healthy practice is always a conscious, informed, and balanced practice. What does that mean practically? It means being aware of your habits. It means making sure this activity enhances your life rather than detracts from it. It means being honest with yourself about frequency and impact. So how do you know if your habits are healthy? Ask yourself these questions. Is this interfering with my daily responsibilities or relationships? Am I using this as my only coping mechanism for stress or negative emotions? Am I experiencing any physical discomfort or injury? Do I feel compelled to do this even when I don't really want to? If you answered yes to any of these, it might be worth reassessing your habits or talking to a healthcare provider. On the flip side, healthy self-pleasure as part of your wellness routine looks like this. It's occasional, comfortable, doesn't interfere with your life, and leaves you feeling good afterwards rather than guilty or stressed. It's one tool among many for managing stress, maintaining physical health, and supporting your overall well-being. I want to emphasize something really important here. Your health is your responsibility, but you don't have to figure it all out alone. If you have concerns about any aspect of your sexual health, please talk to your doctor. I know it can feel embarrassing, especially for guys who grew up in an era when these topics were completely taboo. But I promise you, your doctor has heard it all before and wants to help you stay healthy. We're trained to have these conversations without judgment. And look, if you're sitting there thinking, well, this all sounds reasonable, but I'm still not sure what's right for me, that's completely fair. Everyone's situation is different. your health status, your relationship status, your personal values, these all factor into what's right for you. The point of this video isn't to prescribe a one-size-fits-all approach. It's to give you the information you need to make your own informed decisions about your health. As your doctor, my job is to give you the complete picture. That means talking about the benefits, which are real and scientifically supported. But it also means being honest about the potential downsides if things get out of balance. True health isn't just about doing one thing or avoiding another. It's about finding what works for you as a whole person. I've been doing this work for over 20 years, and one thing I've learned is that the patients who do best are the ones who are informed, honest with themselves, and willing to make adjustments when something isn't working. They don't follow every trend or piece of advice blindly. They take in information, think about how it applies to their life, and make conscious choices. That's what I want for all of you. So here's what I want you to take away from this video. First, this is a normal, natural part of human sexuality that doesn't end at any particular age. Second, there are genuine health benefits to maintaining this aspect of your wellness, from prostate health to stress relief to better sleep. Third, like anything, balance matters. Too much of anything can become a problem. And fourth, if you have concerns, talk to a healthcare provider. Don't suffer in silence or worry unnecessarily. If this video has been helpful to you, I'd really appreciate it if you'd hit that like button and subscribe to the channel. I make videos about all aspects of health and wellness for older adults, and I try to tackle topics that other people shy away from, because you deserve straight answers about your health, not vague advice or outdated myths. Drop a comment below if you have questions or if there are other topics you'd like me to cover. I read every comment, and your questions often inspire future videos. And if you found this valuable, please share it with other men who might benefit from this information. Breaking down the stigma around these conversations helps everyone. Remember, your health is your responsibility, but you don't have to navigate it alone. Stay informed, stay healthy, and I'll see you in the next video. Take care, everyone.